Welcome everyone to IsisParenting's Breastfeeding Chat and Learn. My name is Nancy Holtzman and I'm here in Needham, Massachusetts, the home of IsisParenting, here with Cindy Meltzer, who's in the other room and is moderating the chat. And today we're going to talk about breastfeeding positions and positioning. And this is not an exhaustive tutorial, but I thought I would comment on some specific nuances and tips and techniques for the variety of breastfeeding positions that you probably know about and maybe some that you don't. Starting off, I think I just want to talk a little bit about, in any position, some things to be aware of in terms of your baby's body alignment. So in general, in just about every breastfeeding position, you always want to make sure that your baby's nose and belly button are in a straight line with each other, because it's really hard for your baby to relax and drink and swallow if his head is turned off to the side. So I'd like everybody at home to humor me for a moment, and assuming you're sitting up or laying back, turn your head completely to the side so that your chin is now over your shoulder, and now try to swallow some saliva. It's really hard to swallow when your head is twisted to the side that way. Now imagine if your baby is lying on his back in your lap. He has to turn his head to reach the breast. So it's going to be hard for your baby to drink and swallow in that position. If the nose and the belly button are in a straight line, then you know that their body is well aligned and it's going to be much easier for them to drink. Tummy to tummy, and that is so that they're cuddled up very close to you. And in particular, when your baby is young, if you're a mom who's struggling with sore nipples, you want to make sure that the baby's arm is not serving as a bolster between the two of you, because that actually keeps the baby just about a quarter of an inch further away from you. And think about having the baby's arms come around you more like a hug, so that the top arm may be over or on your breast, and the bottom arm may be closer to your rib cage or your belly, or if your baby is older, it might even be starting to be tucked under your arm a little bit along your rib cage, but not trapped between his chest and your belly. In terms of your baby's head, I'll talk about that more in other positions, but another thing I'd like you to try with a mouthful of saliva, try tucking your chin way down towards your chest so that your chin is now resting on your upper chest, your collar, and try to swallow. And that's really hard to do. Also, try to open your mouth really wide in that position. That's awfully hard too. So if you want to get your mouth wide open for a deeper latch, the better way your baby will have an easier time is with their head tilted back a little bit, so with the chin up in the air a little bit more, not curled forward to the chest, but almost reclined back. Another key to positioning is what your hands are doing. So you do want to pay attention to your hands, whether they're supporting your breast or supporting your baby. In this top picture, which I've marked not like this, I'm really concerned about what this mom's index finger is doing. She's really encroaching on the space that the baby needs access to. And I don't like to talk about things like making sure that your fingers aren't touching the areola, because people's areolas are all different sizes. I've seen some nipples and areolas where the areola is about the size of a quarter, and others where the areola is about the size of a big oatmeal cookie. So it's not very valid to talk about that. But in the C hold, when you're supporting your breast, whether on the outside or the inside, you want your hand wide open, and you want to really be supporting the base of your breast so that the palm of your hand is almost touching the rib cage. You don't want to have your index finger creeping forward toward the nipple like you see in this top picture, because that's going to limit the amount of breast tissue the baby can draw in. In terms of support for your own wrist, as many of you know, once you've got your baby latched on well, you kind of freeze in that position, and that's hard for your own body, and your neck muscles may get tight. You want to remember to drop your shoulders, take some deep breaths, but you also want to make sure that you have some support for your wrists and your arms. So a nursing pillow or a bed pillow or a couch pillow may help support the baby or bring the baby up to a higher level if you like that. But you also may want to have handy what I call receiving blanket sausage. So just a few cloth diapers or receiving blankets that you've rolled up tightly that you leave near your nursing chair, so that you can grab one of those, and that can really help support your hand like you see in this bottom picture, or you can fold one up and it can help support the baby's head, so that you can then relax your arm, relax your wrist, and not feel like you're trapped in a particular position. So you want to have your hand wide open. And another thing I just noticed in the picture on the upper right that I commented on is in general, especially when a baby is very young, try to avoid holding their head anywhere that a hat would cover, because it's very distracting to babies if you're stroking or touching or pressing on their head, and they also have a reflex where they'll often try to push back into the warmth of your hand. So if you're having that issue where your baby is arching and pulling away from the breast, sometimes inadvertently it may have to do with reflexes that they have, like if their feet are pushing against the back of the chair or if your hand is pressing on their head. Okay. In terms of seating and your position, earlier on Twitter, I was saying that glider rockers and rocking chairs are not always the best place to breastfeed, particularly if you're just learning how to nurse and if your baby is very young and very sleepy, because the rocking motion can make a sleepy baby even sleepier. And if your baby is 4 days or 8 days old, perhaps if they're struggling with jaundice, for example, they often do fall asleep because of the warmth of your body heat against them. And once they start sucking and relaxing and they get a little bit of milk into their belly, some babies will start getting very sleepy and stop feeding efficiently and effectively. And so often moms are spending a lot more time trying to keep the baby awake and drinking. And so not being in a rocking chair will help you with that. As your baby gets older, you could try breastfeeding in a rocking chair or a glider if you like. But if you're struggling with breastfeeding, if you're struggling with a sleepy, jaundiced baby, then a rocking chair may not help keep your baby awake and alert enough. Another reason why a rocking chair is not always desirable in the early days is because you may not have enough room to maneuver yourself, your baby, and then if you're using a nursing pillow, you may not have enough room for the nursing pillow to get everything positioned in just the right way. A rocking chair is really nice for soothing and rocking and comforting a baby after feeding. It may be okay for partners and for bottle feeding, but again, if you're trying to breastfeed, you may not have enough room between the arms, and it's also common to bonk the baby's heads on the handles of the rocking chair. In the picture on the right, you see Susan. She's got a footstool, and it's so funny that I had a mom not too long ago say to me, she came in and I had given her a footstool and a nursing pillow, and she said, you know, I thought that those footstools were just yet another thing that you tried to get nursing moms to purchase, and yet I can see how it's angling my hips. It's making it a lot more comfortable, and she actually had a much easier time latching as well. So a footstool is not just a pretty accessory. It's actually quite helpful in terms of your positioning. Moms that are using a footstool typically stop hunching over their baby, and the legs are more comfortable. You can make a footstool by taking 2 or 3 phone books and duct taping them together. But the Medela footstools are nice because they have a little angle to them. And we did use our footstool in my house for many, many years. And after we were done with it as a nursing stool, it was in front of the sink in the upstairs bathroom, so my kids would use it to wash their hands and brush their teeth. And I like the My Breast Friend nursing pillow for those people that like a nursing pillow so much better than the Boppy. The Boppy is a great product for tummy time and as a secondary pillow. It's a multi-purpose pillow. That's one benefit because the My Breast Friend is pretty much simply a nursing pillow. It's kind of hard to use it for a bunch of other things. But as a nursing pillow, it really is ideal. It's got the back support. It clips around you. It helps you sit up straight. It's really comfortable. You can actually stand up and walk around the room with it on. Not that you want to have the baby on it, and it's not a tray, but it is a really convenient nursing pillow. And a lot of moms that are struggling with positioning do find it superior over some of the other pillows they've tried. You can use a bed pillow, a couch pillow, or no pillow at all. But for people that are finding they like a pillow, that's the one I typically recommend. And then I just put a picture down at the bottom of a type of chair that I think is pretty helpful for breastfeeding. So I call these club chairs, I think is what they're called. But just like Susan is sitting that's a love seat. You want to have room to be able to maneuver. You want your back to be pretty upright. You can always put an extra pillow behind your back to help you sit up a little taller if it's a very reclined chair or couch, or if it tips you back too far, you can put an extra pillow behind yourself. So let's talk a little bit about some actual breastfeeding positions. This is probably one of the positions that I steer brand new moms away from, the cradle hold. And this is the one you'll see in a lot of old paintings at the museum and so on. It's just the classic baby cradled in the arm. And a lot of times, mom's hands aren't really part of the equation. In the right-hand side, you see she's using one hand, the inside hand, to support the inside of the breast. Um, in the badly positioned cradle, you see that baby looks to me like he's almost on his back and the head is turned toward the breast. And of course, it looks like it's pretty poor, shallow attachment. That cartoon mom is going to have a very cartoon sore nipple pretty soon. But in general, I steer people away from the cradle position until they feel like breastfeeding is going very well, and they've got the latching thing down, because in this position, babies can kind of slurp themselves on, chew their way on or off. Moms don't have a lot of control over helping the baby latch in this position. And for moms with really large, heavy breasts, it may not be a position that's comfortable at many stages of breastfeeding. I do prefer the cross-cradle position if there are sore nipple issues or latching issues. It's a little bit more of an awkward position, but because you do have one arm that's kind of sticking out like a chicken wing initially, but even so, you have a lot of control over helping the baby latch. A few things about this position: you always want to remember the baby is laying on his side facing you. Again, the baby is not on his back with his head turned toward the breast. So the baby truly is on his side facing you, and then the same hand supports the same breast. So if you're going to nurse on the right breast, your right hand is supporting the base of the right breast, and then the left hand is cradling across the baby's back with your fingertip and thumb behind the baby's ears. Wide open C to support the breast, and use that hand when the baby's mouth is open wide. You use the hand supporting the nape of the baby's neck between their shoulder blades to bring the baby in closely and quickly to get that latch. I put a few different views of the football or clutch hold here because sometimes it's hard to see what's going on from the mother's view or from the inside view. So for example, the picture in the upper right where the mom has a blue shirt on, that's kind of a good picture because you can see the inside view of the football hold or the clutch hold. Now you can stack a couple of pillows next to you and lay the baby almost on his back, or slightly angled facing you, and then use your inside hand to support the breast. You can also sit the baby up a little bit in that position. So in a lot of these, it looks like the baby is reclined under the breast. If you have a heavy milk letdown, you may want to actually try having the baby sitting up a little bit, and they're actually looking up and over onto the breast. Make sure in this position that you're not tucking or curling the chin down toward the baby's chest. We already talked about if the chin is down, the baby's not going to get a wide open mouth. So even in this position, you kind of want to support the back of the baby's shoulder blades and let their head tilt back a little bit as you bring them onto the breast. Another issue with this position that most people aren't aware of, and it may not be a problem when your baby is just a week or two old, but if you're still trying to nurse in the football hold when your baby is a few months old, you will find that the baby starts pushing off and arching at the breast because their legs are now long enough to reach the back of the chair. And if their feet are touching something, they are, by reflex, compelled to press against it. And so it will be frustrating for both you and the baby because you're trying to get the baby latched and the baby is right there at the table and wants to eat, but their body, their reflex, keeps pushing them away from the breast. So they'll get frustrated and you may get frustrated and neither of you may understand the reason why. So what can solve that problem is putting an extra pillow behind you so that there's more space between you and the back of the chair or the couch. A lot of moms leave the hospital or birth center nursing in the football hold and stick with that position for the first few weeks and are a little bit afraid or intimidated to try another position because they found one that works and they don't want to mess with that. So I would encourage you, though, to work on the cross-cradle as well. I think it's just as easy, if not easier, to nurse in the cross-cradle position. And certainly, if you can nurse in more than one position, it's going to be very beneficial. Here's one of my favorite positions, and this one's not so easy to learn, especially during the first couple of weeks when a baby is very small, very young, and needs a lot of help latching. But don't give up. If you've tried it a couple of times, or if you've tried it in the middle of the night and it didn't go so well, don't give up. This is a really beneficial position to master. My suggestions here are to try during the day when the lights are on and you're wide awake and you have the patience and the time, and you can see what you're doing. So when you're home, even take your shirt off so that there's no fabric that gets in the way. And you're going to need 3 pillows. You want to, let me move to the next slide because I staged this for you. And because I was frustrated, I really couldn't find images that showed exactly what I wanted to show. So here is my tutorial on how you can actually nurse on both breasts without turning over or turning the baby over. You can nurse on the bottom breast, and then you can nurse on the top breast, and you can do it comfortably. What you need are 3 pillows, a small pillow for behind your head. That one's not essential, but it's comfortable. A big pillow for behind your back, and here I'm using one of the Theralines, which is one of my favorite types of body pillows that we have here at ISIS. But if you have any body pillow, that will work fine. And then a pillow between your legs. We used a boppy because that's what I happen to have here at ISIS. But at home, of course, that would be a bed pillow. So again, a pillow behind your head, a pillow between your legs, and then a pillow or a body pillow, preferably behind your back. To nurse on the lower breast, you're going to roll your body back toward the body pillow. The baby is on his side with a rolled receiving blanket behind the baby. And that's helpful because with a rolled receiving blanket there, it's going to keep the baby from slightly relaxing and rolling back onto his back while he's still latched, which can make you sore. So sometimes if you're able to get the baby latched in the side-lying position and then you doze and the baby dozes, the baby may still stay latched and suckling, but may relax or recline back a little bit. And so now all of a sudden they're suckling more with a shallow latch on the end of your nipple rather than a deep latch, and that's going to make you sore. So a rolled receiving blanket behind the baby will help keep the baby on his side and prevent that from happening. When you're ready to nurse on the top breast, at that point you can shift your hips. So instead of reclining back slightly, you can shift your hips and roll forward slightly. So you can see in the final picture on the right-hand side, look at the difference, the angle of mom's hips here. She's reclined back to allow room and access for the bottom breast, but then shifting her hips and rolling forward slightly to nurse on the top breast. And you'll have to readjust the angle of your baby a little bit, but you don't need to flip over or move your baby to the other side. And again, I really encourage people to practice this during the day and to get good at nursing laying down, because in the afternoon, when you can nurse your baby down for a nap, and then you can stay right there and take a rest yourself or read a book or work on your laptop. And then certainly if you're having a rough night, this will allow you to bring the baby in and have a feeding in your bed, and hopefully the baby will drift off to sleep and you can then reposition your baby and go back to sleep yourself. I did want to just say a word about safety in terms of side lying. The bottom picture is a mom side lying on a firm flat mattress. It looks like they're on top of a quilt, so it's a little bit too fluffy for me to say that's a truly safer version of side lying. But compared to these pictures up top, these are scary and dangerous. So one place that you really don't want to share sleep with a baby or allow a baby to sleep is on a couch. There's just way too many risk factors for suffocation and entrapment with couch cushions, particularly. You've got a parent who's deeply asleep, you've got the baby who's deeply asleep, and it's easy for the baby to get wedged between the parent's body and a couch cushion or between 2 couch cushions. So no sleeping on the couch. And if you do bring your baby into bed for feeding and resettling, you want to make sure that there's no pillows or quilts near where your baby's sleeping. Like in the picture on the right, the baby is up nice and high in the bed, is swaddled, but looks like there's a lot of pillows and quilting around that baby. So I'm not going to get deeply into sleep safety today, but just as a reminder, the American Academy of Pediatrics does suggest in their safe sleep guidelines, you may bring the baby into bed for feeding and settling, but then they do recommend that when you're ready to return to sleep yourself, you move the baby back to their own sleep surface. Okay, and then the final position here, of course, is the ninja hold. And sometimes moms that have a very heavy milk supply or an overactive letdown, These are moms who leak and spray, and babies cough, choke, and splutter when they're latching. And also sometimes this goes hand in hand with reflux, not always. But if you do have a very, very heavy milk letdown or oversupply, then some of these positions may help you. This is called laid back nursing, or some people refer to it as biological nursing. But essentially, the baby is dominant to the breast, and even young babies really can find their way around and get latched in this position. So this is it's becoming one of the more trendy positions over the past 5 years or so. Some people, kind of are more disdainful of the cross-cradle position with the footstool and the nursing pillow and so on, and talk a lot more about this laid back or biological breastfeeding. I say try different things and see what works for you. I've had a lot of moms who are struggling with latch typically do very well in the cross cradle position with the footstool and the nursing pillow, but each to their own. Positioning for overactive letdown, head higher. So I like this fountain picture in particular, because if you look closely in the background, you see mom is modeling her nursing position after the stone statue directly behind her. And then, of course, since I'm talking about heavy milk letdown, I like the analogy of the fountain and the pouring liquid. But notice the angle of the baby's head is at the level of the breast or above, and the baby's body angle. So the baby's head is more upright or higher, and that can help with reflux. And for the occasional baby who actually refluxes or leaks milk from the nose when he's nursing, and some moms have never heard of such a thing until it's your baby and your baby spits up through her nose or nurses and has milk drip through the nose. You'll know what I'm talking about. But head at the level or above of the breast, and the head is higher than the belly, and sometimes that will help. And then finally, upright positioning. And this is a little bit more unusual for some people if you haven't seen this type of position before, but your baby actually can straddle the hip, and you can use a folded towel if you have a newborn and want to nurse in this position. It's actually nice because the baby is peeking right up over the breast, and you can see your baby's face, and the baby can make eye contact with you. And for other special situations like babies that have hip dysplasia and maybe in hip braces, it's not particularly, it's not 1 in 5 babies, but I don't know, maybe 1 in 1,000 babies end up in a hip brace during the first couple of months of life. And that's very tricky to find positions to breastfeed when they are frogged out like that. This bottom picture in the bottom left corner, I don't think that the baby necessarily is in a hip brace, but that's exactly the frog-like position that a baby in a hip brace maintains at all times. Okay, so in terms of soreness, you want to pay attention to your latching position, and the middle picture cartoon I really like because look at the way the hand is positioned, supporting between the baby's shoulder blades, fingertip and thumbs behind the baby's ears. Mom's hand is a big wide open C. She's got her fingers well away from the areola, and that's a great position to get a nice deep latch when the baby's mouth is open wide. You may want to experiment with a nursing pillow and have the baby, make sure the baby is turned facing you. And again, some of those key alignment issues, like making sure the baby's nose and belly button are in a straight line, baby's belly to belly or chest to chest with you. And then are you hunched over? Are your shoulders up high by your ears? Remember, after you've got your baby latched, to take some deep breaths, drop your shoulder, roll your neck. Use a footstool, and don't tuck the baby's chin down toward their chest. Let the baby's head extend back slightly just before you do the latch. And then I just plopped this one in because it's a very unusual nursing or pumping position, but we call this the dangle pose. And of course, I'll have to make a slide for myself because it's not something that I can find easily online. But this mom obviously is doing some yoga or stretching. But this is the same position you would use if you have a blocked duct that's having a hard time clearing. You can get in the shower, soap up your breast, do some massage, and then come out of the shower and have your baby laying down on his back. And then with no bra on, you want to just let your breast dangle and lean over your baby on your hands and knees like this with a pillow for support and let your baby nurse. And the breast should be in free fall. And you can do the exact same thing pumping as well if you need to. And sometimes that really helps a blocked duct clear a little bit faster. And I have a whole webinar on blocked ducts and mastitis and clogged nipple pores that you can access as well if you want more info on that. Okay, a few slides on nursing in public and nursing toddlers and other situations, and then I'm going to get to the questions. I see we've got a bunch of questions coming in, and I should be able to get to all of them. So choose your places wisely. Pick places that are child-friendly, family-friendly, places where moms go or congregate, and places, most importantly, where you will feel comfortable. And in terms of suggested spots for some of your earlier ventures out with your baby, coffee shops, restaurants, family-style restaurants, bookstores are nice. It looks like we're in a library in the corner, but those places usually will have a comfortable chair tucked in a quiet corner of a bookstore, for example, and that might be a good place to nurse. If you're in a restaurant or a coffee shop, choose a place where you're going to feel most comfortable and most at ease. So, for example, you may, if they seat you at a table right in the middle of the room, if you think you're going to feel more comfortable at a corner or against a wall, then just ask for that. Just ask to sit somewhere different. Some women want to sit against the wall, looking out into the restaurant. Others may want to have their back turned toward the restaurant. You just need to decide what you think will feel most comfortable for you. Another thought I have in terms of nursing in a restaurant is go with a group of moms. So here at ISIS, we run the Great Beginnings New Mothers Group program, and part of the curriculum is to have the moms go out for walks, go out for lunch, go to the mall, go to mom movies, so that they get practice being with their babies out and about, soothing, feeding, caring for, changing diapers in a variety of public settings, but they're surrounded by other moms and babies who are working on the same thing. So it can feel much more comfortable if you're not alone or just with your partner or a family member who keeps looking around and saying, are you sure this is okay? Are you sure you're comfortable? So go with 3 or 4 other moms who are also working on breastfeeding or bottle feeding or just caring for their babies. And it will be, you will be surrounded by support, and that will be helpful. When you're nursing outside or in a mall, one suggestion I had is to take your stroller, if you've got your stroller with you, park it directly in front of you and then put the brake on. And that way you have a little bit of a privacy barrier, but also now you can put your feet right up on the basket or the big wheel of the stroller, and it won't move because you put the brakes on, and that can serve as a makeshift footstool. If you're someone who's used to using a nursing pillow at home, try taking your jacket or sweater and fold that up and use that as your nursing pillow. And also you can take your diaper bag and tuck that under your thigh, and that can help raise your whole lap up so that you can get yourself positioned more comfortably. Okay, now some people find it preferable to use a nursing carrier for discretion or even a breastfeeding cover-up. Remember, that it's really much more about your own comfort level and less about what you need to do. So if you're going to be more comfortable using a nursing cover-up, if you're stuck in the middle row of an airplane, if you're at a family dinner seated next to your father-in-law, if you want to use a nursing cover-up, then by all means go ahead. But I also encourage moms to practice breastfeeding in a variety of settings, and in particular in your own home. When you have company over, people are welcome to walk in and out of the room or to casually go into another room if it makes them feel uneasy initially. But I think the more normally you treat breastfeeding, they're going to take their cues from you. If you feel like you need to excuse yourself and go into a bedroom every time it's time to feed, you're going to have a rather isolating experience. And if you're just comfortable breastfeeding on the couch at somebody's home, then I think that people will gradually take the cue from you and treat it as though it's something completely normal, because guess what? It is. Nursing in carriers takes practice, just like nursing takes practice. But soft structured carriers like the Ergo or the Lilla Baby are decent for breastfeeding, and then slings and carriers also. I personally like a ring sling. Those are an acquired taste. There's a little bit of a learning curve there, but you can easily nurse with the head opposite the rings, just like the picture of the person on the right-hand side. You start off in a tummy position, and then you can shift the baby at an angle and nurse on the side opposite the rings. Now, what happens when you have the classic distracted baby who is 5, 6, 7 months old, and you're out, and you used to be able to take them anywhere, they would nurse anywhere and then fall asleep, and now all of a sudden they keep whipping off the breast to turn around and see what's going on, and they're leaving you flapping in the breeze. So if you know you're going to a play group or the mall or a restaurant or a place where your baby is very likely to be distracted, why not try offering to nurse them again just before you leave the house? So do one final feeding before you leave, and this is not to say to get into the habit that you're going to nurse and then you're going to race out of the house and race through all your errands so that you can be back within 2 hours. No, I think that if your baby is young, you want to plan in a sort of a rest and relax and refuel break, but you'll realize when your babies are a little bit older that they are less inclined to relax, feed, and sleep in different types of settings. So offer that one final feeding before you leave the house, even if you just fed them an hour before. See if they just want to top off. And then you can go out, and I do recommend these nursing tanks. I just think these are the best things since sliced bread. My 3 favorite products for the last decade for nursing moms are the hands-free pumping bra, the larger size flanges, and these nursing tanks. And my kids are 15 and 17, and I couldn't even find a black nursing bra, never mind a nursing tank way back when. But the picture of the mom who's nursing in the orange tank top, the tank top is her regular tank top, and her nursing tank is the gray one underneath. So the really nice thing about these is it turns any shirt into a nursing shirt, and you can bring your t-shirt up, and your midriff is still covered with the nursing tank. And even in the summertime, you can even just wear the nursing tank as is. But I think these are wonderful for nursing out and about because it really does help you feel more comfortable, especially after you've had a baby. You may feel like you've got a little extra love handle on the sides, and this keeps you completely covered. And they're just so versatile. But one rule I use, a phrase I use a lot, is 3 strikes, you're out. So if you're out with an older baby and they seem hungry or they seem to ask to nurse, and you nurse them, and they just keep pulling off the breast and leaving you, uncovered, and they'll come back and they'll take a few more suckles, and then they'll come off and look around a little bit. If they're just not interested enough to get down to business, then you can close up shop for a little while. So if you keep trying, 3 times, you keep trying to put them back to the breast, they nurse for a few seconds at a time or half a minute at a time, and then they pull off and they want to sit up and look around and squirm around, they're probably not so hungry. So maybe then you can just buckle up and go on with your activity, and later on they'll either be hungry and will get down to business, or they'll just decide they'll wait till they get home, or maybe they'll be content with a sippy cup of water or solid foods if they've started that. So if you're not comfortable because they keep pulling off and leaving you exposed, don't feel like that you have to just sit there and let them pull off like that. So you as your baby gets older, you decide what your rules are, just like all the other areas of parenting that you'll have to decide what the rules are. With a toddler, in terms of positioning, anything goes. So we really aren't so concerned about the baby's position. Babies will kind of, they'll crawl over and nurse a little bit. They'll grab their foot while they're feeding. Sometimes they'll position themselves almost upside down. They are like little gymnasts. If they're kicking you in the face, if they're reaching to hold your other breast while you're nursing, if you don't like that, then you just simply nip that one in the bud. You're in charge, just like you're probably not going to let them throw food at the kitchen wall indefinitely. You're probably not going to let them turn their sippy cup upside down and shake it and shake it and shake it indefinitely. And you don't have to put up with bad manners at the breast either. So it's okay to end a feeding or to set limits. And of course, the baby in the bottom left corner is signing milk. As I mentioned in my sign language webinar and in the nursing toddlers webinars, use a word. Teach your baby the sign for nursing or the sign for milk. just like you can teach them the sign for eat, the sign for more and all done, because it is a communication tool that babies can use as early as 9 to 12 months, and it really limits frustration, and it's a very nice way of asking for what they want or need. They're not going to yell out any obnoxious phrases for nursing unless you teach those phrases and or reinforce them. So think about what you want to call nursing as your baby gets older, because that's the word they're going to learn. So you could just call it milk, like, baby, do you want some milk? It's time, do you want to sit down and have some milk? Because then maybe you'll be at Target and they'll just look at you and say, milk, milk. Well, that's not so horrible. Babies are not going to learn those other words if you don't teach them and reinforce them. Okay, so let's see. I'm going to get to questions. Just a quick reminder, next week, add it to your calendar now. Please help us by spreading the word about the breastfeeding webinars. We record all these, so you can look back at the archived topics, whether you want to learn more about starting solid foods or using ASL with your breastfeeding baby or introducing bottles to the breastfed baby. All of the topic recordings are there, thanks to Cindy. And you can follow myself on Twitter. You can follow Cindy on Twitter. And please, of course, follow IsisParenting on Twitter. And help us spread the word through other new moms group lists and email listservs that you may be on. Cindy, if you can switch to the other slide presentation, I'm going to start answering these questions. It looks like we've got about 8 questions, and my goal is to get through them today. Next week, the topic is going to be all Q&A, so I'm not going to have a planned topic. I'll just take all of the questions that come in. Okay, here's a question from a mom who says, if I haven't been successful with breastfeeding for 8 weeks now, I'm convinced I have very low milk supply, though I was pumping 6 to 8 times a day, drinking nettle tea, lots of water, and fenugreek up to about 3 weeks ago. Is it time for me to just give up, or is it still possible to fix this problem? Please note, when I do pump, I don't yield much milk, maybe 5 mLs after half an hour, so I am feeding baby formula. Okay. Oh, my heart goes out to you, because it's true that sometimes things don't go the way we want them to go, and sometimes we know why, and sometimes we don't. If you haven't had one-on-one consultation time with a really skilled practitioner, a really skilled IBCLC, that might be something that you want to think about, simply because it can help you process your experience. It may give you more information down the road for if you do end up having another baby down the road. There are a lot of reasons why sometimes people just don't make milk the way we want them to and the way they want to. Everything from polycystic ovarian, certain causes of infertility may also be hormonal imbalance and may be related to breast milk production. Physiologic differences within the breast tissue. So, for example, sometimes we ask about breast changes during pregnancy. Was there an increase in firmness and growth of the breast tissue? Did the areolas and nipples become darker and veins more prominent? Breast growth and tissue growth during pregnancy is a very nice hallmark of the breast preparing to breastfeed. Sometimes the birth experience itself can have an impact. If a mom has lost a lot of blood, if she had a hemorrhage, with or without a transfusion, sometimes that can put the body into a certain type of shock that makes it very difficult to initiate full lactation after. Thyroid issues can create problems with milk supply. Retained placenta. There are many reasons why sometimes women are not able to fully initiate lactation. Your baby's 2 months old. You've been diligently working on pumping, it sounds like, but are still experiencing very low volumes. If you were someone that I had met early on, I would be asking a lot of detailed questions. Also talking or asking a little bit about medical history, and sometimes, depending on the situation, this is why certain medications are sometimes prescribed. So there are things like metoclopramide, which is called Reglan, and domperidone, which is Motilium. So sometimes those are helpful, but not always. And there's over-the-counter things that sometimes people will try, like fenugreek. You mentioned the nettle tea. Golacta is a relatively newer one on the market, but some people respond well to that. If you had a history of thyroid issues, that would be something that you would have checked your blood levels checked to see if your thyroid levels are okay, and so on. So it's hard for me to give an answer as to why the situation may be, but I also think that when when somebody is trying and trying and trying, if you don't feel as though you're making progress, then and you feel that it's impinging on your quality of life or your ability to have time to do all of the things you want to do and need to do, both for your baby and for yourself, then it's certainly something to consider. Your baby does benefit from each and every drop of breast milk. There's thousands of cells in each drop of breast milk, but each person needs to decide what length of breastfeeding is going to be the right length for that family. So I don't know if you're local or not, but we can try to put you in the right direction in terms of getting, if you're interested in finding somebody that's really skilled that can give you some personalized guidance on that. But ultimately, it's up to you how long you want to continue. I think if you are pumping 8 times a day and getting 5 mLs of milk after half an hour of pumping at 2 months, it's not likely that there's going to be anything magic that we can offer right now that's going to completely turn that situation around. Hopefully the situation can improve. How much, I'm not sure. Other things I didn't mention that I'm just thinking about quickly before I move on to the next question, any history of breast surgery, breast reduction, those types of things as well certainly will play a role. Okay, next question. Do you have any tricks or tips for nursing a baby in a carrier, a Mobi or an Ergo? My 2-month-old loves to be worn, and sometimes I'd love to be able to feed him without taking the carrier completely off every time. Yeah, that's a great question. I would practice at home. I would take some time to really practice with focused attention. So, for example, maybe sometime where nobody's home, just wear your bra. Don't even let your shirt get in the way, and play with positioning your baby in the carrier. Have on hand a few of those receiving blanket sausage so that you can shift your baby. You can support either your hand or your baby's head or neck. Of course, you always want to make sure you can visualize your baby's face and nose so that you're making sure they're getting plenty of airflow. But babies can nurse in an upright position, or they can nurse at the diagonal position in both of those types of carriers. Group meetings like a drop-in breastfeeding group at ISIS, a La Leche League, or a Nursing Mothers Council meeting, as well as groups of baby wearing aficionados, will be able to help you with hands-on positioning. But I think that if you look at some of the suggestions online, and you also practice at home when you're awake and your baby is not frantic and you're not impatient, you can play with it a little bit until you figure out 1 or 2 positions that work well for you. Okay, next question. Any tricks, any ideas on how to get my baby to open her mouth wide? She's stopped and won't deep latch, and it's becoming a problem. Okay. Yeah, so let's see. Remember my tip from the positioning portion where we talked about tilting, making sure your baby's head is tilted back a little bit so they're leading with their chin and are not tucked forward. It's really hard for a baby to open their mouth wide if their head is tilted forward. They've got no room for their jaw to go. Another thing is to really wait for that wide open gape, and you can stroke the baby's nose and upper lip with your nipple, or if your nipple is tender, you can use your knuckle to do that, and wait until the mouth opens, and then use your hand to draw the baby in quite close. Sometimes when babies are very sleepy or small, if they came a little bit early, sometimes just doing some kind of waking up exercises, oral exercises can be helpful. So try doing little cheek circles with your fingertips. You can trace the lips with your finger, and those types of exercises, and begin to wake up the muscles of the mouth and the muscles of the chin, and can sometimes help the baby achieve a better latch. But I would try to avoid letting the baby latch any which way or chew her way on or slurp her way on or off, because as you probably know, that's more likely to make you sore. Hi, I have a 4-week-old and I'm building up my freezer supply. We're moving and I will be driving 8 hours to our new home. What's the best way to transport frozen milk at that time distance? Great, that's great. And congratulations on your new home and on your freezer supply. Let's see if I've got a picture of that. I would just take the milk still frozen and put it in a cooler. And I would take maybe, depending on how much milk you've got there, I would take several 1 or 2 liter bottles of water and fill them up and freeze them and have that be your cold source. And just keep that cooler closed, and everything should stay pretty much frozen. And as soon as you get to your destinations, put it right back in the freezer. And don't worry if it's minutely thawed. It's not a problem. But that should be a pretty easy one. If there's any room left in the cooler, use crumpled up newspaper or paper to insulate it. So the cooler should be completely packed tight and full of frozen milk and these big 1 and 2 liter frozen water bottles, and then packed with crumpled up newspaper. And it should be just fine for 8 to 12 hours. Okay, so this same mom that we were talking about with the supply concerns says, yes, my breast did not grow during pregnancy. I had hemorrhaging. I had blood transfusion. I had placenta left inside me after 6 weeks postpartum. I'm sorry. I'm sorry. You had a lot of things stacked against you. The breasts not growing during pregnancy certainly is important and a concern. The other things hopefully would not reoccur during another pregnancy. Another thing I'll mention is during each pregnancy, more and more breast tissue proliferates, and that's also why women typically have more milk, and milk comes in sooner with subsequent pregnancies. So just because you or someone else did not have a good breastfeeding experience with your first baby does not mean that that will replicate for a subsequent pregnancy and birth. And breastfeeding experience. There's a great book by an author, Stephanie Casemore, called Breastfeeding the Second Time Around, and she talks a lot about processing breastfeeding experiences, what may or may not be a recurring issue, and how to approach your second pregnancy and your second hopeful breastfeeding experience with your deck a little better stacked for success. Yeah, you had quite a few challenges going on there. Okay, next question from an old friend who comes to chat often. My 8-month-old has outgrown the breast friend and even the flatter boppies, but I still need support at least under my knee, sitting cross-legged, to avoid hunching over and straining my lower back. Any other positioning or prop suggestions? Yes, I do. So try a few different things and find out what is going to feel most comfortable and best for you. Try different types of bed pillows, firm and fluffy, or imitation feather. So it's got that what do you call that foam, that where it maintains your the indentation. I can't think of what that's called. Try also like a decorative couch cushion, a little heart-shaped cushion or a little round cushion. That's maybe all you need to support your baby's head and shoulders and your wrist and arm. It doesn't have to be it doesn't have to be a product that's sold in the store as a nursing pillow. One product that is sold that might be nice are those pregnancy wedge pillows. I'm not sure if you know what I'm talking about. They're not large, and they look kind of like, like a big slab of cheese from a wheel of a cheese. It's a little bit angled, but that actually can be nice as a small nursing pillow. But I think even something makeshift would work well for you. A bed pillow, a couch pillow. You could even try a folded towel, like a beach towel or a bath towel could work well for you, because usually firmer is better. Okay, and Mom likes these ideas. She posted. Okay, final question. Let's see. Have one more. Oh, this mom. Nope, this mom was just adding extra. Oh, here we go. Do I have any tricks or tips for nursing? Oh, we did that one. I think we've got all the questions. Did I get all the questions? Let me just double check here. Sorry for the dead air. That's the problem with being a one-man show here. Here's one. Any recommendations for positions that work for older infants? My 6-month-old hates to recline. I think it's teething related. Hates to recline, teething related. Well, certainly cross-cradle or cradle often work. Think about sitting cross-legged, and think about your baby's bottom kind of deep in your lap, so that they are in a more upright position. I don't think I have a picture of that per se, but rather than the baby laying horizontal, let's see, yeah, not like that. But rather than the baby laying horizontal in front of you, think of the baby's bottom down between your thighs if you're sitting cross-legged, and make sure you've got back support. And the baby's chest and head is up more towards your breast, so that's more upright. And then the pictures I showed from the other deck, I don't have those images in this slideshow, of the baby. You could try the baby sitting on your thigh or straddling your thigh, and that one can work well too. Let's see, you could also try the kind of a laid back position. So you could recline back on a bunch of on a pillow or two on your bed, for example, and have your baby be approaching the breast from the side. So your baby may be kind of leaning against your rib cage next to you under your arm, and coming on the breast that way, or the baby could actually just be laying on top of you like you saw in the pictures. Typically that's more of a newborn position. But you could play with that as well. Okay, I think it's about time for us to wrap up, and this was great. We had a lot of moms with young babies, so hopefully some of the positioning tips were helpful for you, and a bunch of questions. And I'm proud I was able to get to all of them, which isn't usually the case. Next week we're going to do all questions for the whole time. So whether they're breastfeeding or pumping or feeding solids, or introducing cups and straws, or anything related that you'd like to talk about, I'm game. And meanwhile, of course, you can look at the archive topics, which Cindy keeps maintained on the same website that you came through to the chat today. Next Wednesday, we have a great evening webinar planned. It's on PPD, postpartum depression and anxiety and panic disorder, post-traumatic stress disorder, and OCD, obsessive compulsive, and the fact that 12 to 15% of women experience some of these serious mood disorders during the first year of life after baby, but few talk about it and few seek help for these symptoms. And it maybe it doesn't affect you, but it could affect your sister or your sister-in-law or a friend of yours. So just to be able to understand some of the things to watch for, and how to reach out and help somebody who's really struggling, and what are the most effective treatments, because we use both behavioral counseling, medications, anti-anxiety and antidepressant medications, and so on. And what are the risk factors? Who's more likely to have a postpartum depression? So this is a great topic. It's a great webinar. It's Wednesday evening. I think Cindy is going to be the speaking moderator, and I am going to be the chat The chat room moderator and the two experts are fantastic. Catherine Stone is the founder of Postpartum Progress. She is an advocate for women with postpartum depression and other mood disorders, and she is fantastic and a great speaker. And then Dr. Marlene Freeman, who is at the Mass General Hospital Psychiatric Women's Health Program, is going to be speaking as well. So I hope you'll join us on Wednesday and see us back here next Thursday. And I'm sure I'm forgetting something or another, but so be it. So thanks everybody for attending, and I'll see you all next week or on Twitter. Bye-bye.